A ban on fluoride in public water in Utah, and Health and Human Services Secretary Robert F. Kennedy Jr.'s comments on the topic have really raised questions now about its safety and why it's used. 9 News medical expert Dr. Kohli is joining us today to talk a little bit more about this controversy. Dr. Kohli, good morning.
Good morning.
Okay, this is a very important topic right now that a lot of people are weighing in on. Historically, what we have seen is that fluoride is in our drinking water, right?
Yeah, I mean, we added it in the 1940s, Jordan, and it's been touted as one of the greatest public health accomplishments of the 20th century. And in fact, what it did is it reduced the rate of tooth decay, and it really evened the playing field in terms of having people have access to regular dental care. Even if they don't have it, it kind of made it so that they wouldn't have a high risk of tooth decay. So if you think about what fluoride does, is it protects our teeth in a few different ways. So first is it prevents demineralization. So it prevents kind of the breakdown of the enamel. Second is it actually promotes remineralization. So it puts enamel back onto our teeth, and it also has an antibacterial effect. So having it in the drinking water has really allowed many more people access.
Now, let me ask you, because of course everything you said is a big argument for proponents who want fluoride in the drinking water. If there is one day a time when we do not have it in our drinking water, is there another way that we can get fluoride?
So we think that about 75% of our fluoride comes from water and processed beverages like sodas and juices and such that are made with water that have it. About 25% comes from other sources, from the soil, from the environment. Even our fluoride toothpaste, in fact, in modern day America, provides us with fluoride. So most of it does come from the drinking water, but people who are sort of against the fluoride say perhaps we're getting too much and it's causing problems.
Okay, that's a good question right there. How much is too much? What is the amount that's actually needed for the health of your teeth?
So safe amounts in the water, which are, by the way, very closely monitored at the state level as well as the local level, are 0.7 parts per million. Now, what the studies have shown scientifically, and the reason this has become a debate, is that if you have double that, 1.5 parts per million, and live in an environment that has a lot of fluoride in the soil, you could potentially have kids that have lower IQ. So it's been associated with sort of neurodevelopmental problems. The American Cancer Society has also looked into whether or not it's associated with an increased risk of cancer, and that's not really panned out much. But if you get it in very high doses, it theoretically could have a risk of toxicity, which is why this whole debate has surfaced.
Now, oftentimes as we do our own research here, you will hear us say a lot, talk to your physician specifically about this. I'm just curious, because you obviously meet with a lot of doctors every day. Where do they, as well as the Public Health Organization, really stand on this debate?
So the American Dental Association, the CDC, and pretty much every public health organization says we should keep fluoride in the drinking water, because taking it out would be a huge step backwards. Now, I'll add a little asterisk or caveat to that, which is that the concentrations need to be really carefully monitored. Because it's really important for us to get some fluoride from our drinking water, but if we get too much, and if you look in countries like India where they have soil that has more fluoride, you can potentially have adverse effects of too much fluoride. So as long as we're keeping those concentrations safe and accounting for the fact that in drier climates, people may be drinking more water. So you may need a different concentration in different parts of the country, but if that's happening, we need to keep it in the drinking water, because taking it out of the drinking water would be a huge step backwards in terms of what we've done for our oral health, and also really creating more of those socioeconomic disparities, because there are parts of the country that don't have access to dental care.
If you are someone, though, like you said, that maybe you get enough fluoride from other things and you want to kind of remove that drinking water aspect, how would you recommend, what are some alternatives that you would say?
So I would say do a couple of things. One is look on your kind of local website and see how much fluoride is in your drinking water that you drink. Second, try to consider alternative sources of water like bottled water that don't have fluoride added if you're concerned that you might be getting too much fluoride. But most importantly, talk to your dentist and talk to them about your sources of fluoride, whether it's from food or toothpaste or what have you. Because again, you don't want to get to the point where you're getting too little, because that can really affect our oral health.
I want to ask a quick question. Of course, a lot of people have, Brita filters and other kind of filtration systems. Does that keep the fluoride in the drinking water?
It does. Okay. Yeah. So it's a metal, and so you usually can't get it out with those types of filtration systems. So you can't extract the fluoride out of the water like that.
We appreciate your time this morning, Dr. Kohli. Thank you very much. And you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.